I just want to thank everyone for joining. Safety reps from both HAs and teams are with us, as well as some others. So thanks again. Just want to welcome Dr. Tina Atkinson back from her whirlwind travel with Team Canada women's team down at the rivalry series in the US, and did certainly well the last few games, Dr. Atkinson. So we're all interested to hear how that went from your experience. But yeah, just to introduce Dr. Atkinson, for those of you who don't know, she's a Chief Medical Officer with Hockey Nova Scotia. And really the focus today is on concussion awareness and management, as well as some emergency action plan and first aid kit discussion as well. So just a big welcome to Tina, and thanks for doing this. And thank you all again for attending and being interested in this topic. I'm going to pass it to Darren Sutherland, our staff at Hockey Nova Scotia, to just run through the agenda and some housekeeping. Darren.
All right, thanks, Mike. So, second here. So obviously, as Mike mentioned, this is being recorded. If you have some questions, at the end, we'll try to maybe, I'll monitor the chat and just throw some questions in there, and then we'll try to save those for the end. But if there is something that maybe is applicable at some point, maybe I can jump in and mention it to Dr. Atkinson at that time. So I think it'll be probably pretty informal here, just trying to get some information to everybody. So just tonight, some opening comments, just a little bit of an overview of the new Safe Sport Committee and kind of what the intent and where they're going with that committee. It's fairly recent start here. So there's some subcommittees that have developed from that committee. So just a bit of an update on where that's going from Dr. Atkinson. And then the focus tonight will be on concussions, and then we'll have some Q&As if there are any questions. So that's kind of it. I'll turn it over to Dr. Atkinson.
Thanks, Darren. Yeah, so I just got back from Los Angeles last night, and it was a great trip. We won both games, so that's the main thing. And we had lost 3 before that. But it was fantastic. I have to say, we played at the Staples Arena CryptoCom now, and the LA Kings were fantastic hosts, and it was a great atmosphere. So that's always awesome. I'm a little jet lagged, but happy to be doing this tonight. And we've had lots of questions and feedback that people want more information. So I'm really happy to do this. And like Darren said, I really would like it to be informal. And if you do have questions as we go, maybe put it in the chat and I'll see it there, or Darren can just ask the question. So I really want this to be very clear, so people don't leave this feeling more informed and not like they have more questions. So we will be sending a resource package of these slides, as well as some other information out at the end. And there's always, if you want more resources after that, I can always do that as well. So as far as the safety committee, it's been really great to have so many people so interested in this topic, as far as trying to provide a medical safety person for each team and elite for this year, starting from 13 AAA and up and older, as well as a safe sport rep for the younger teams. We're just going to review those 2 roles. And my plan in the new year is to obtain some feedback from the various teams in different age groups, because we really want to hear what they think as far as what they need to feel safe. We in the elite athlete world, it is definitely turning to more of an athlete-centric model that can only make sports safer. And so really that's the goal amongst all national sport organizations, and will trickle down to minor sports. So, it's important to understand and see what these athletes want and what they need. So that'll be happening in the new year. We have some teams that have volunteered already. Okay, next slide. So our medical subcommittee, which is a subcommittee of Hockey Nova Scotia, which I am leading with Mike, and now that Mike has his new role with Darren, we've been looking at the current medical training requirements, trying to come up with some minimum credentials, minimum standards that all minor hockey teams and elite, all teams should be able to follow, and hopefully have people that are designated as a safe sport person and or the medical person on each team, and what the minimum standards are for that person. So we have two subcommittees out of our safety committee that are working on each of these roles. You know, everybody knows about the hockey safety program. We want to review this, and we are starting to develop an in-person sport-specific hockey medical training program. There is something called the Sports First Responder, which several of the people that work with teams already have. But there is more and more interest in developing a sport-specific hockey medical training program. And obviously it should be in person. You know, it's very easy to click through a module and not necessarily get as much out of it as you definitely would in person. Sport Nova Scotia is looking at developing and implementing provincial-wide policies and standards. I've talked to, in my role as the CMO of the Sport Institute Atlantic, this is something that we're working on. As well, I'd like to have a resource bank of resources, websites, people that can do training on different topics related to injuries and injury management, related to illness, and related to all other safe sport topics. So the Safe Sport Safety Role Subcommittee is looking at the roles and responsibility of the Safer Sport representative that will be a resource to the minor hockey associations. This position is really the evolution of the safety rep, which we introduced during the COVID pandemic. And we would like it, and we've had feedback that it was very helpful. It was very challenging at times, but most people felt that it was an important role to continue. And some of the responsibilities will be to generally give advice and manage illnesses, which has been a big concern this last month or so, 4 to 6 weeks, and will continue into the new year, where, in winter you have combination of influenza starting to happen, normal respiratory viruses that are around, and of course still COVID-19. That safer sport person, medical person, which should be on all teams, including the young at all levels, will collect the player health information so they have in case of an emergency, help develop the team emergency action plans, which I'm going to talk about a little later, and help to be a resource to ensure the proper return to play post-injury, especially if they have difficulty seeing their doctor or there is some kind of complication along the way. They'd be able to be a resource for that issue. And finally, act as a team resource regarding the Universal Code of Conduct, which Hockey Canada has now signed and is a signatory to uphold that contract and overall maltreatment. And we want to work towards abuse-free sport. So that safer sport person is an evolution of the safety rep role. And this is the basics that we would like them to be able to handle. So we are still working on that as far as recommendations, the specific roles and responsibilities, and the minimum credentialing that they should have. So that will be finalized soon, and we'll get that information out as soon as we have it in the new year. So I'm going to move on to concussion education awareness. And this is a slide from a presentation I did not too long ago for phys ed teachers of Nova Scotia. But these are all the different groups that I'm working with right now. And it is actually a federal initiative for each province to have a focus on and a management strategy for concussion. So that's been, I think, 18 months to 2 years. And we have done a lot of work in Nova Scotia on the concussion awareness and education piece. There is a concussion awareness week and a concussion awareness day every year, which is in September. But we have a lot more to do. So I do presentations all the time, and different groups. And really what we would like is for Hockey Canada has its own concussion policy, but I find it doesn't always get translated down into the teams. And so we really want people to think about, does your team have a concussion policy, or are you following the Hockey Canada concussion policy? And how do you make sure that concussions are managed up to the latest gold standard information? So just some basic information, and I actually took this from the Hockey Canada website. There's various definitions of a concussion. They're all very similar, but slightly worded differently usually. So I actually like this one because it's very straightforward and easy to understand for everyone. So a concussion is a brain injury. It's technically called a subset of a mild traumatic brain injury. So a moderate or to severe brain injury would be someone that has severe brain damage caused by a car accident or a high-speed accident, or sometimes a stroke or some other kind of brain abnormality. But a concussion is a mild traumatic brain injury. So that's the first thing, because a lot of people actually still don't believe that that's true. It is caused by the brain moving inside of the skull. So that's why it's so difficult to you can't tell that someone has a concussion or might have a concussion just by the hit. So, you know, in the good old days when I was in high school and I was playing sports, you know, people would have judgments on, well, that wasn't a bad hit, they can't have a concussion. But we know that's not true. It can be a relatively minor looking hit. It really depends on what happened to the brain inside the skull. So when that brain is shaken around inside the skull, what happens is it actually causes damage with proteins and chemicals and signals across the brain cells. So the brain cells now are inflamed. There's an inflammatory cascade, and they're not functioning like they used to. So this can lead to symptoms that can be in several different categories. So it can be physical, where the person feels a headache or is dizzy, blurry vision. It can be cognitive, where they just can't remember things, can't concentrate or focus. And sometimes the first thing that you see is an emotional reaction. They can feel depressed right away. Oftentimes people are really upset, really angry, crying, sort of have kind of an emotional response. So it's very important to know that a concussion doesn't look the same in every person, and it can even look different in one person that's had different concussions. Like each concussion can look different. So a concussion can result from any impact to the head, face, or neck, and it can actually be a blow to the body, which causes the jolting of the head. So the impulse force moves up and causes a jolting of the head, and then the brain shaking around inside the skull. So just a little bit of a quick update on prevention. So I get asked all the time, what about prevention of concussions? What can we do to do that? So it's difficult because we know that concussions are going to happen in sports. So the best thing that we can do is to try to make it as safe as possible. And that includes, this is a general slide, obviously not just for hockey, but that includes using seat belts, booster seats, and well-fitted protective sports gear. I think, as everybody knows, it's important to have a helmet that fits really well. There is no helmet right now that has been shown to protect against concussion or prevent a concussion. Helmets do help prevent more severe, like a skull fracture or brain bleed, but there is no evidence yet that any helmet prevents concussion. There is, interestingly, new evidence that certain mouth guards can help reduce the severity of a concussion. But that's tricky as well, which I'll talk about later. So the other part of prevention is proper training for contact sports. So that means doing checking, showing people how to take contact, how to give contact in sometimes limited amount of contact in practice. Football certainly is following this now. More supervision for practices and games, making sure that things don't get out of hand and there's not too much incidental or sort of fooling around contact, as well as rule changes in sports. So when they eliminated body checking in hockey until age 15, there is evidence coming out now of several years worth that showed that it did decrease the incidence of concussion. Concussion awareness and education can be a type of prevention. So more people know what causes a concussion and what to do when one is suspected and one happens, to try to prevent something more severe from happening, such as something called second impact syndrome. So that leads me to Rowan's Law, which is actually a law in Ontario named after a 17-year-old high school rugby player who died of second impact syndrome. So they had an inquiry into her death, and it turned out that she had had symptoms of concussion at probably several in the week leading up to the game, where she actually suffered her last head injury and died. So this has been turned into Rowan's Law, which is several points of concussion awareness and implementation in schools, as well as teams and all sports in Ontario, and it led to this National Concussion Awareness Day. Secondary prevention is really what we're talking about tonight, which is to be able to recognize that this player possibly has a concussion, remove them if you suspect one, and avoid a second concussion while they already have a first one, which is what leads to second impact syndrome. It's a rare condition, but it does happen. What happens more commonly is that someone has a concussion, they keep playing, they get a second hit, or they play 2 days later, get a second hit, and then symptoms that might have been very mild or actually they didn't really feel much can really exacerbate, and that person can now take quite a long time to recover. So this part is really important. That's really what I want to focus on tonight, as well as follow the return to play and return to school guidelines I'm going to talk about, to make sure you recovered fully and you don't get a second concussion on top of your first one. Okay, so 4 steps to concussion management. This is taken from the CIRC website, which is a sport resource website, SIRC, which if anyone wants more information on concussion, you can certainly go there, as well as to the Hockey Canada website. And there's a program, there's lots of programs out there, and they have lots of good information and tools that you can use with your teams. So these 4 steps are really, really basic and really easy to remember. So the first one is recognize. We're going to tell you the signs and symptoms of a concussion, and you don't have to be the person that diagnoses the concussion. You don't have to know that that person has a concussion for sure. You just need to suspect it and then know what to do. So the second step is you remove the player from the activity. So anyone with a suspected concussion should never return to play that same day. I get this question all the time, and someone gets hit in a game and they start to feel better, and they're in a tournament, they have a game that night. They should never, ever go back that same day. This is not something that should be negotiable or you even talk about or try to justify. It's just not, it's a too risky situation. And so we need to remove that player. And then the third step is to refer them to an MD or a nurse practitioner for a diagnosis of a concussion. This is usually confirmation. I feel that a lot of times, there are many physio, chiropractors, other athletic therapists who are very experienced in concussion. They don't, as far as the government of Canada is concerned, they are not allowed to officially diagnose that concussion. I am aware that there are a lot of physicians out there that are not up to date on concussion, and they might, you might, or your player might actually know more than the family doc does, for instance, or even the emerge doc. But what we need to do is make sure that this is standardized as much as possible. So I would like, in many cases, especially with athletes, it's important for them to be monitored and know that they're 100% ready to return to play. So you can look for a concussion clinic in your area. Many physio clinics, and like I said, other therapists of different types run concussion management clinics across the province now. Some tips on what to look for to know, is this a concussion clinic that I can trust, and do they work with athletes, is they should mention something called the SCAT-5, which is the Sport Concussion Assessment Tool. That's going to change to the SCAT-6 or 7 now, and we'll get that information in the new year. There's something else called the Buffalo Treadmill Test, or the Chicago Blackhawks Test, which is a intensity test to determine how much activity you can do as you're trying to get back to play. And of course, they should be able to give you a medical assessment letter for your team saying that you do or don't, they feel you do or don't have a concussion. And then we're going to talk about the return to play here in a second. And the final step is return only when you're symptom free. You've completed the return to learn. So these are athletes that are all in school. They should be 100% back in school and symptom free before they get to the final stage, through the final stage of the return to play. So this is pretty easy to remember: recognize, remove, refer, and return. I think we have some questions in the chat there.
Yeah, you see that one, Tina? Just from should we be concerned for any liability issues from HNS or local association if for some reason the secondary prevention isn't followed?
Yeah, I mean, that's always a concern. I don't know directly. I mean, the world is changing. I would expect soon this is going to be a big issue. Yes. But, you know, if the person's been removed, then there is no chance of liability. So, you know, I know people are doing their best. They're volunteers. I know in Nova Scotia, we have a volunteer act, which actually is quite protective of a volunteer. The part of the reason we don't have legislation in Nova Scotia on this is because I've been told other provinces have tried to do it, like Manitoba, but they were worried about the liability issue because their volunteer act didn't protect them as much as ours. So I don't, you know, if people are following the rules, which I'm presenting tonight, which is exactly what you can find on any website about concussion, taking that player out, I'm not worried about liability.
Yeah, and I would just add that through your registration with Hockey Nova Scotia and Hockey Canada, there is liability insurance affecting you as well. So, yeah.
So this tool is, so just to give you sort of a background on this. So every 2 years, there is an international consensus conference on concussion. It was delayed during the pandemic. So they actually just held it again in October, early November, maybe in Amsterdam. So every couple of years we get updated information on concussion. And this is the last one from 2017, which is the concussion recognition tool. I don't expect this to change too much, but it's just a quick checklist. You can find on the internet. It's free to download, to laminate, whatever you would like to do, and just have it rink side so that, you know, sometimes it's a very emotional thing, and it's very traumatic for people when someone gets hurt. So, you know, you need to just have something to refer to. Then this is nice and clear. So it talks about when to call the ambulance if they have any of these specific signs here, to kind of remember what to do. I can't actually read it that well because it's a little small on my screen. But the observable signs, things that, you know, a lot of times, as you all probably know, if you ask a player if they're fine, they'll say yes. They try not to make eye contact. They might look like they're doing okay, or they might tell you they're doing okay, sorry. But sometimes you can see hints that they're not. And that's just by watching how they fell, what they did when they tried to get up. Were they stumbling? Are they confused? Are they not responding appropriately? Do they look blank? These things are all very common. I've certainly seen all of these. The other thing to look for is a more severe facial injury after falling, or a contact or a hit or a slash or whatever it might be. That's a clue that you need to look for concussion as well. And then the symptoms are all symptoms that people will tell you that they have. You know, I really caution you about asking, do you feel fine? Are you good? Are you good to go? Because they'll almost always say yes. It's just too easy to say yes there. So I would actually ask them specifically, do you have a headache? Do you have pressure? You know, you don't have to go through all of these, but basically if they answer yes to any of these, you should suspect a concussion and take them out. I didn't talk about how you do, you know, a concussion. There used to be a grading of concussion, and it sort of was it really was determined by whether you've lost consciousness or not. Now we know you do not have to lose consciousness to have a concussion. But if you do lose consciousness, even briefly, then you definitely had a concussion. That can be brief. It can be, you can feel good. The thing is, a lot of us who do concussion work, especially at sideline, often people that are knocked out and lose consciousness, they feel better than the ones who weren't initially. I'm not sure why, if it's because they don't remember it, and so there isn't the trauma there, but they often feel pretty good. And so you just have to be really careful. If you saw them and they were lying motionless, or someone got to them and they definitely were knocked out, then they have a concussion and you need to follow the next steps. If they're saying, the step 4, the memory assessment, this is really just to try to convince them that they have a concussion, to me, because if you've seen any of the symptoms or watch them be dizzy and hard to get off the ice, if you're still not sure, then you can ask them these memory questions. And these are just sort of some very specific ones to see how they answer. I have had other trainers, I know junior A trainers, who have told me in the past they'll hand them their phone and get them to try to play a game on their phone and see if they can focus on that. Like, sometimes you just have to convince the athlete that, no, you're not right, and we've got to take you out. So just some tips there. If you suspect a concussion, they shouldn't be left alone. They should not drink alcohol. They should not go drive themselves home or go home by themselves. No other recreation or prescription drugs. And just another, in red there, just make sure that if they have suspected concussion, they should be immediately removed. And that includes in practice, which sometimes it's easier to say, okay, sit for a minute and then come back out. But we just want to make sure that they're okay. They can be assessed the next day. I've certainly done that in tournaments, and sometimes they are okay, but it's rare. And I wouldn't want anyone else to try to clear them and make that judgment themselves. I've occasionally done that, but I also have 15, 20 years of experience assessing concussions. So it's much safer for everyone if they go out and then, they're removed and then they don't come back that day. And then the next day they can start the return to play or return to learn protocol. So this is the up-to-date management of concussion. I don't want anyone on this call to necessarily feel like they're responsible for this, but if everybody talks the same language after concussion and keeps it consistent, it's always better to that person's recovery and less confusion. So, it's different than it used to be even a few years ago, where we told people rest until you feel better. What we do suggest is complete rest for the first 24 to 48 hours, avoiding screens, sleeping as much as you need to. It's okay to have your phone literally for a minute and text your friends to tell them okay, text your parents or whoever. But if people don't avoid screens and their symptoms linger, I can tell you they always have regret about that and just wish, I stayed off my screens for that first 24 to 48 hours. But after the 48 hours, even if you have some symptoms, your symptoms should be improving this whole time, like for the 2 days when you're resting. But even if you have some symptoms, it's okay to start returning to light activity, gradual exposure to screens and other sort of normal day-to-day activities like getting dressed, getting out of bed, having a shower, things like that. When I say return to light activity, I literally mean try to walk for 5 minutes and see how you feel. So it's not a green light to go back to doing a workout or going to the rink, but it's just to get moving and not stay in bed too long and start exposing your brain to just normal day-to-day activities. And so the reason why we do this is because the last international consensus conference showed that the prolonged rest, like people staying in bed for a week to 2, actually did more harm than good. Their symptom scores were higher after they stayed in bed. So we don't do that anymore. Another tip, if you have athletes that are not seemingly not improving, is after they sleep as much as they need for those first 2 days, they really need to get on a good sleep hygiene or good sleep routine. So going to bed the same time and getting up the same time every day, one nap or eliminate the naps and just get their sleep back on track. We know that kids and teens are sleeping less than ever and not getting good sleep, mostly because of screens, we feel. So it's really important for your brain to get back on a good sleep routine and not sleeping too much during the day either. This has certainly happened with many of my athletes, and it just makes them feel worse than all their other symptoms if they're not sleeping well. So the return to physical and cognitive activity should be gradual and individualized. So I'm going to show you examples of some protocols, but remember, each concussion is different, each person's different, each amount of activity that their brain might be able to handle is different from the next person. So we do try to base it on what symptoms they have and how much they can tolerate activity. So with an athlete, for instance, we're probably going to increase their activity level more quickly than someone who's more sedentary and just not used to that much physical activity. But the main thing here is return to learn and return to play protocols must be followed to make sure that they're 100%, their brain is working well before they return to hockey. So just a little information, like I said, we know a lot since the 2 concussion conferences ago, and we used to tell people to just stay in bed. But if you do too much too early, the risk is your symptoms get worse. It can slow the recovery. That person feels very overwhelmed, especially players in any kind of, under 18-year-olds, under 20-year-olds. They can tolerate the physical activity pretty well sometimes, but when they go to school is really where they get overwhelmed, or they're trying to study or trying to work. And then they'll feel like, well, I was getting better, but now I feel worse again. So it really needs to be a real gradual progress. If you do too much too early, it causes a lot of stress, and we definitely see anxiety and mood issues increase. It's a very emotional issue, concussion. So following the protocols really helps to make it like any other injury, where you have an injury, we have a plan, we know how you're going to recover, and try to keep the emotional side of things to a minimum, which is tricky. But once they get anxiety, and everybody has anxiety when you have a concussion to some degree, but if you know that there's a plan, and you know that we can get you back to your regular life, including your sport, then it really helps with that anxiety and mood issue. On the flip side, if you do too little too late, if you stay in your room and you're in the dark room and you're just not doing well, I still see this all the time. There's a real risk of social isolation. This is a big problem for kids and teens. And so that's why you need to be able to give them their phone just briefly to check in with their friends and have some kind of communication. When people start to not feel well, when they've been resting that long, then they get really worried about, why do I still have these symptoms? Something else is wrong, and second guessing. Also, they miss too much school, which creates a lot of worry. I also see this all the time. And the anxiety and the mood issues increase. So you really have to try to find that balance. And like I said, that's individual. We really have to just take it case by case. So this is an example of a return to school protocol. So this one is sort of a compilation of lots of different ones that we found on the internet, and very wordy, but just meant to give people more specific information about what they can do at each stage. So most schools, understand concussion now, but I would recommend that the parents are advised to contact the school as soon as possible and let them know that their child likely has a concussion and needs to be off school. Most of the time I see someone gets hurt on a Friday, Saturday, or Sunday, and they go back to school Monday morning. They call their parents at lunchtime and say, I have to come home. I'm going to stop there. Is there a question, Mike?
Yeah, from Kelly about just, do we require a medical doctor's note before the player can return? And she mentions it for C hockey.
Yeah, I'm going to get to that. So Hockey Nova Scotia policy actually does say that you have to have a doctor's note for any level of hockey, but I know that that's really tricky in a lot of cases. So I'll get to that in a minute though. So you can see there that first stage is rest, which is the stage I talked about. It talks about what you should do, what you can do while you're in that stage. And then we move to light cognitive activities, stage 2. And so it talks about how much you can do, a little bit of reading, a little bit of drawing, limited computer. And then stage 3 there, where you're doing some walking or yoga, stretching, household things around the house, and a little bit of schoolwork or homework at home. And that's where you should be able to go back to school. So most people are able to tolerate 15 to 30 minutes of reading at this point. You could still have symptoms through this whole time, but the whole point is that what you're doing at each stage does not make you worse, and you need to wait 24 hours in between each stage. So after stage 3 there, you'd be back to school part-time, and then you just slowly increase your amount of intensity that you're doing at school and at home. Most schools in Nova Scotia that I've dealt with are pretty good about this. Some might not be as up to date. And so I encourage you to send this to your school if you encounter any difficulty with the VP or teachers not having dealt with a player with or an athlete with concussion before. So that's something you guys can read on your own. And if you have any questions about it, just feel free to email me afterwards. So you can see the return to sport one is very similar. And really, we do both of these in parallel. The only caveat being that, like I said in the beginning, they need to be fully back to school before you can go past stage 5 here. So that can take quite a while as well. So, you know, even though I say you have to wait 24 hours in between stages, it doesn't mean you automatically get to go to the next stage after 24 hours. Sometimes people might take 1, 2, 3 days in here to go from stage 2 to stage 3, for instance. This is tricky with hockey because it always depends on how much ice time you have, because we're asking you to do, to get back to practice and do, and the Hockey Canada website has the hockey specific one, but you can do light skating, for instance, skating without gear on. Now you could do that anywhere. It doesn't have to be like on a designated practice time. But then the next step after that is sport specific drills with no contact. And then there's a contact practice before you go to games. So a lot of times, and you know, this takes longer than 6 or 7 days. It kind of looks like it takes 6 or 7 days here. And what I can tell you, they decided, and they found out from this last international conference, is that it is taking the average return after a concussion for an athlete, that basically an uncomplicated return is 12 to 14 days. So it's a lot longer than we used to think. We need to think about this being the new normal. Some people are going to go through this quicker and some people are going to take longer. But I think there's a sort of thought process out there that, okay, once I'm in the return to play protocol, I've got a week and then I'll be back. And it doesn't always go like that. So it also depends on how many concussions you've had in the past and what your symptoms are, how long it's going to take you to get through this. So for instance, if an athlete's had several concussions in the past, I'll definitely slow down here, and the non-contact team drills and the full contact practice will probably do 1 or 2 of those at each of these steps. So this is where Hockey Nova Scotia says that they should have a note, is in between stage 5 and 6 for any contact checking hockey. If you're non-contact, you don't necessarily have to have a note. And if you know, what I do, like I said, there are several concussion clinics around the province, and I work with each of them to say, so sometimes they can't see a doctor, and I can do a virtual consult, or I can just speak with that therapist and know that they've followed the steps and they've gone through the protocol. So, you know, I'd encourage, and I often know someone maybe close to your community who also manages concussions. So what I don't mind if anyone reaches out to me if they're having a problem, getting that note or finding someone who will clear them at that stage. So I'm going to stop there for a sec because that was a lot of information, but does anyone have any questions on either of those 2 protocols? All right, we'll keep going then, Mike or Darren. Thanks. So I just wanted to point out, this is pretty new information here, but we talked a little bit about mental health after concussion, and there is a lot more research and information on this. And so there's something called the Healthy Behavior Report that is published every year. And part of that, there was a section on concussion, and it was a little bit surprising, but not, I think, to the general population, but not really with those of us who see and manage concussions on a regular basis, that these youth are between 13 and 18, and they self-reported that if they had had a concussion in the past year, they were less likely to be satisfied with their lives, more likely to report a lot of emotional problems and poor psychological well-being. So, concussions are associated with poor negative mental health outcomes among youth. There have been some studies that suggested a higher risk of suicide after concussions. What the literature that I've read, those were the ones that were either hidden, that no one knew about, or they weren't managed properly, and the person actually returned to their sport before they were 100%. The emotional problems that they reported were difficulty getting to sleep. So like I said, sometimes having a concussion, having a headache, being anxious, all of those things can prevent you from getting to sleep. And if you're not sleeping well, it's very common to feel depressed, feel like you're in a bad mood, and just generally nervous, which is higher after concussion anyway. The overall poor psychological well-being, and they're not able to participate in their sport, really is very important to kids and teenager adolescents. So they're not doing the things that interest them. They don't feel good. They don't feel calm, relaxed. They don't feel like themselves, basically. So I just wanted to add that here because it's something we don't often think about, but something I very commonly see. So this is a card that Brain Injury Nova Scotia has actually developed, and what it is actually going to be a little small card that can be clipped onto a backpack or a hockey bag, for instance. So they're printing these. It's very similar to the concussion recognition tool that I showed you in the beginning, but this is something that will be available from Brain Injury Nova Scotia, and it's sponsored by the government and by Child Safety Link at the IWK. So something that anybody can they'll be free. I'm not sure how many they've ordered, but if you're interested in these, I think we're going to look into getting a large number of them, or getting one at least for every safety person. So it'll be a handy thing to just have on hand. We are planning on doing some education sessions in schools in the new year as well, with Brain Injury Nova Scotia support, and handing out some of these tags to kids as well. So this is just a checklist that I developed, which would help you to know. I get this question all the time. How do we know that they're ready? So one thing I didn't talk about yet were persistent symptoms of concussion. So that used to be called post-concussion syndrome. Now it's called persistent symptoms because not everybody has the same symptoms. That's about 20% of athletes. It's anywhere between 15 to 20. So it is. People are always very frustrated when it's your child or your teammate or someone on your team that just seems to be having this prolonged recovery. Like, why aren't they feeling better? But it's actually it's the most common reason why I see people in my clinic, because they are referred to me because they just don't seem to be getting better. And often there's something specific that is a symptom that is lingering. And sometimes it's even a medical issue that they had before they had a concussion. For instance, ADHD, history of migraines, those can both contribute to having symptoms for longer. So a checklist, I don't intend this to be sort of a disciplinary or a punitive kind of thing, but for the safety reps on the call or the medical people on the call, it's just something to remember. Have they gone through all these steps? So are they symptom-free? That's something that sometimes gets overlooked. They're like, no, I'm good enough. I feel good. I'm good to go, but they're not actually symptom-free. And then after that first game back, they're going to tell you, I don't feel great. And then they have to go back and go backwards in the return to play protocols until they do feel well. So have they actually followed the full return to play and return to school protocols? And this one is really important. Are they psychologically ready to return? So this is quite a newer sort of concept in injury management, not just concussion. There is a psychological readiness scale, which I can send if anyone's interested. You can Google it and find it. So it's a series of questions that gives you a numeric score that can indicate that yes, they're definitely ready, or no, they're kind of borderline or not ready. So this is important because that mental health piece, like I said, sometimes they've been cleared, but they know they don't really feel ready for whatever reasons. They feel a lot of pressure. And so I actually see this a lot in midget age players, junior players, and older. They have a lot of regret afterwards that, I knew I wasn't ready and now I haven't felt 100% for 2 years. And what do I do? And sometimes they've developed a mental health issue now, and it's not really their concussion anymore at all. But the way to prevent that is to make sure we treat this like any injury and just go through the steps and make sure that they're ready before they go back. Also, do they have a medical clearance letter from a concussion clinic? And ideally, a doctor or a nurse practitioner that's experienced in concussion management, which I acknowledge is tricky in Nova Scotia. There are more and more people who understand these words: return to play, return to school. But if you don't, like I said, reach out to me. So anybody that is playing checking hockey needs a letter before they participate in a contact practice. And then if they get through that contact practice with no symptoms, then they're cleared to play. As well, just remember to fill out the Hockey Canada insurance form, especially if they have symptoms that linger and they might need more intervention later on. It's better to do the Hockey Canada insurance form right away. So key messages, I just hope that everyone acknowledges that we all have a role to play. And by that, I mean coaches, the players themselves, teammates, coaches, anyone associated with the team, parents, we all have a role to play in promoting awareness of concussions, and we can all help educate. We need to encourage people to speak up and tell a parent, coach, or teacher that they might have a concussion. A teammate can tell a coach. It's in that person's best interest. Learn the signs and symptoms that we just talked about. Symptoms can be delayed. So sometimes, I hear all the time, well, I felt pretty good. I went out for a couple of more shifts, and then at the end of the game, I felt really horrible. I mean, that happens. I don't think we need to blame anybody in that situation, but just know that that can still be a concussion from that hit you got in the first period. You just didn't really feel much until the game was over. Definitely know the red flags, when to send someone to the hospital immediately. Know how to manage the first few days, because it is hard to see a physician. A lot of times you don't have to go to emergency. So that's that first 24 to 48 hours I was talking about. Be aware of and know about the return to learn, return to sport. And overall, for parents and for the athlete that's injured, know that you're not alone. Other people feel the same way that you do, and there are resources and tools to help. So I just want to, for those people who always tell me, well, why are we doing this if the NHL doesn't do it? This was posted in the Kings visitor dressing room that I was in yesterday, where I was also told is where LeBron James has his massages when he wants to get away from the rest of the team. But they do the exact same that we do. And oftentimes I feel that the higher levels of hockey are actually more cautious about concussion than sometimes the lower levels. And I just really feel like we need to eliminate that, and we need to make this a standardized way of management. And this should not be new information anymore. This should just be what we all know what to do if we suspect a concussion.
Okay, just a question in the chat. So, and I think this probably pertains to like on the spot, kind of like when something happened. So the safety rep had the final say if a player is removed or can continue.
Yeah, so this is tricky. I would say if it's a designated medical person that has some medical training, like for the elite teams for this year that we were suggesting, and then yes, that person should have the final say. This should all be discussed with the coaches ahead of time. Ideally this is done at the meeting in the beginning of the year. The safety rep on the other teams, if you feel comfortable, if the coaches, most coaches tell me they would rather not be in charge of medical. They would rather have someone else make that decision. So my suggestion would be yes, but I'm not going to mandate, I can't mandate that person has the final say. but it should be discussed with the team, the managers, the coaches at the beginning of the year. The coaches all have training on concussion as well, but they're in the middle of coaching. So it would be better if the safety rep, like a concussion spotter that, happens in the NFL and the NHL. If sometimes you see something that the coach didn't see, or the player confides in you, then it would be ideal if it was someone else other than the coach that, I don't want to say final say because that's a hard one, but basically has the knowledge and the awareness that this person should come out. Yeah. So these are some resources that I found on the Hockey Nova Scotia or Hockey Canada website under their Hockey Canada Concussion Toolbox. And they're actually really good. It just reinforces what we were talking about, what I just talked about. Also, there's a template for an emergency action plan, a graphic with a flow chart that you can go over for each of your teams. And the concussion card is very similar to, it has the concussion recognition tool and then some other information on that one as well. So I encourage you to click on these links. We're going to send all these out afterwards, I believe, Mike, and just explore that a little bit, but some really good information there.
So yeah, any questions further? Anything else to add, Tina? Like, okay, if anyone wants to go ahead and ask a question, I have the ability here to activate your voice. So if that's easier than typing something in the chat, if you can just raise your hand or say so in the chat, we could do that way as well. So
can I ask a question? I don't know how many questions there are, but just because I like, you hear so much information and different, obviously I think the concussions, it's evolving every day and how they're treated and learning more and stuff like that. But is there any like a time frame when someone is, not feeling good or takes a hit or whatever the case is, that you should wait before you start to evaluate them? Like if they're emotional and stuff like that, is there any merit to that, or should you evaluate like you know what I mean? Like, should they have a couple minutes to calm down, or should it be?
Yeah, they used to. I know the CHL, I didn't read, I haven't looked at the protocol this year, but it used to say 15 to 30 minutes. I think that's important. I just find it's not that reliable. You'd have to know your player really, really well for that to even be a factor. So, on the Mooseheads, for instance, we do that. We know those players really well. They've all had baseline testing done. I didn't talk about that tonight. Baseline testing can be helpful, but mostly I use it as a way to educate the player and the team around concussion. So you can wait for them to calm down. But the other thing is sometimes you watch them come off the ice and they were unbalanced. They had that blank stare. And then they'll kind of say, no, I feel good now. I feel good now, but they still shouldn't go back. So there's very few cases, I would say, that waiting the 15 minutes is actually going to change your mind.
Okay. Just a comment. This was fantastic. Looking forward to having these resources. My son had a concussion last year, and Hockey Canada's website was good, but these two detailed documents seem much more detailed. Thank you for the session.
Yeah, you're welcome. And I hope it's helpful. The other website I didn't mention is we have a group called Concussion Nova Scotia. And like I said, I work with Sport Institute Atlantic, and our information now is merged onto the Brain Injury Nova Scotia website. So if you go to Brain Injury Nova Scotia website and then click on concussion, you'll see a little video that I did about the first few days, as well as lots more resources on there, including templates of the medical clearance letter and just different specific resources for parents and for coaches and things you might be looking for. So check that out. It's always better to do that ahead of time, so you know what's there. We took all the best resources that were out there and tried to put them all in one spot.
Okay, nothing else coming in right now, so.
Okay, so the other thing that we had mentioned was the first aid kit and the emergency action plan, which we're going to send that information to you so you can look at it on your own. And like I said, stay tuned for more specific roles and responsibilities of the safety rep, safe sport rep, and the medical person role coming in the new year.
Awesome. Thank you very much, Dr. Atkinson. And thanks Darren for coordinating this. Thanks to everyone on the call that took the time to join. So you're definitely more informed now, and more tools and resources to come. So thank you, everyone.
Yeah, thanks everyone. Have a good night and happy holidays.